Hi, this is Levi Long, and I'm a fourth-year pharmacy student at the University of Minnesota Duluth. This past year, I got the opportunity to be a part of the first Interprofessional mental health course offered at the University of Minnesota. I was asked to talk a little bit about my experience and the way I view interprofessional healthcare teams. And I think the best way for me to do that is to explain it through an experience I had during an interprofessional meeting. During this meeting, we had an occupational therapy student ask a great question about how interprofessional healthcare teams worked, and he asked it using the analogy of superheroes and basketball teams. Is an interprofessional healthcare team like a team of superheroes where everyone has their own powers and they're working separate yet towards the same goal, or is it like a basketball team where everyone has their own position and they're working together in that moment towards that goal? And I thought about it for a little while and reflected back on my experience in my interprofessional course. And I think at the beginning, I felt as if we really were superheroes. We had our own powers. I had my own agenda, my own questions. They were all pharmacy related, and that's how we interacted with patients. But as time went on and we started to learn more about the other healthcare professions and we started to interact more with them, I started to notice that I really liked the way that DMP asked some questions, or I really liked the way that OT interacted with the patient or asked a question that I hadn't even thought about. And so as time went on, I started to pull these into my toolkit, and I think everyone did. And so by the end of the course, it really felt like we were a basketball team full of superheroes, and there wasn't a question that we couldn't answer or a patient that we couldn't help. And so that's really the way that I view interprofessional healthcare teams.